Hi, today we are going to be talking about a disease called cholera. We are going to elaborate on what cholera is, what are the symptoms, how to treat it, and how to prevent it. So what is cholera? A very interesting question. Cholera is caused by a bacteria called Vibrio cholerae. And this bacteria, it is notoriously known to cause severe, acute, watery diarrhea. Yes, and cholera does date back from so many years ago. As we can see that there's so much research that was done back in the 1800s. John Snow in the mid-1800s conducted a series of field investigations on cholera outbreaks and discovered the cause of the disease. Dr. Robert Koch discovered the cholera bacteria back in 1880s, while Dr. Jan Ferret created the first cholera vaccine in 1885. Cholera is distributed in so many countries. According to the European Center for Disease Prevention and Control, most of the cases have been reported in Africa, and these are cases from July to September 2023. And countries in gray are those countries that have not reported cholera cases before. What are the symptoms? Well, there are quite a number of different symptoms that can be identified and can be an indication of cholera. So some of these that we're going to look at are the common symptoms and the severe symptoms. Amongst the common symptoms, we have watery diarrhea, we have nausea and vomiting. And amongst severe symptoms, one can experience muscle cramps, one can have a rapid heart rate, and also low blood pressure and persistent vomiting. So these are symptoms that one has to be aware of, and if one experiences them, they should have cholera in mind. And how do we best diagnose cholera? One can do a self-assessment of dehydration, and stools can be collected, sent into the laboratory, and culture can be done. And when culture is done, cholera, Vibrio cholerae can be isolated, and then one can be sure of the fact that they have cholera. Also, crystal BC stick test can be used. Treatment. Can cholera be treated? Yes, that is the answer. And how can cholera be treated? If one experiences the symptoms stated above, they should visit a medical hospital or a medical practitioner and get medical attention without delay. Rehydration therapy is very important to replace all the fluids and electrolytes lost. Antibiotic therapy is also used to treat against cholera. Prevention. How can we best prevent against cholera? 1. We have to make sure that we drink safe water from safe water sources. 2. We have to wash our hands with soap and running water. 3. We have to cook our food well, eat it while it is hot, cover our food, and make sure that we wash our vegetables and fruits before we eat them. 4. We can get vaccinated against cholera. And 5. We have to make sure that we keep our environment clean.